here at the Oklahoma Historical Society
Switzer Center on the campus of the University of Oklahoma.
Oklahoma City National Memorial. I'm on the campus of Oklahoma State University, Tulsa, and here in Stillwater, the Oklahoma City Museum of Art.
And now, Generally Speaking, with your host, Dave Bialis.
Hi, I'm Dave Bialis. Welcome to this month's show of Generally Speaking. I've got a couple guests this month. There's a lot going on at the Oklahoma Health Science Center and that whole community. One of the most exciting areas is the Children's Hospital. So this show is going to be focused on kind of different facets of what's going on at the hospital, including some great doctors and researchers that we're recruiting from around the country that you'd be amazed at the things going on, the building that's going on, the fundraising, and most importantly, the treatment that's happening at the hospital that's really becoming world-class. And I thought it would be a good time to share with you what's going on. So I've got a couple of guests here today. Dr. Terry Stoll, welcome.
Thank you.
And Bill Meyer.
Good morning. Meyer.
You're one of the doctors. You're both doctors, actually. I want to talk about a little bit of why you came to Oklahoma. Terry, you're the chairman of the pediatrics department at OU Health, Oklahoma College of Medicine.
That's right, in the College of Medicine in the University of Oklahoma. And really what brought me to Oklahoma was the opportunity to build a department. And that opportunity was not only the great community of Oklahoma, but also Children's Medical Research Institute. So we had a hospital, an academic enterprise, and it's the community involvement that has really made the real difference.
Let's back up a little bit, because it's a little confusing. We're not going to get to all the diagrams of how the organization is set up. But when you came in
94.
The hospital was run by the state, and it's now been managed by a trust, which is combined state and HCA. But what was the condition, I guess, what was going on back then at Children's Hospital?
Well, if you recall, 94 was post-oil bust. And so the organization and the buildings and many aspects of children's health care had fallen on the same hard times that the rest of the state had fallen on. And it was actually one of the reasons I viewed it as an opportunity to build, because I knew just in my brief interactions before I came that the people of Oklahoma valued their children and would want to build something really outstanding, and here was an opportunity.
And so you've been here 13 years, and the growth, are you happy with where you've come in those years? And give me a couple of milestones and some goals that you were setting out back then that you've achieved and some you want to achieve maybe in the next 5 to 10.
Well, the Department of Pediatrics is the faculty dedicated to the medical aspects of children's health care, and we were at that time a faculty of a little over 50. And now we're at about between 100 and 125. Wow. So we've more than doubled. And we have the entire range of medical specialties. So we have gastroenterology and cardiology and hematology, oncology and genetics and even pediatric rheumatology. So we have the entire breadth, and so we've really moved a long ways. And so I would say that we now have both clinical services as well as research and also education opportunities that are of a national standard, and what we'd like to do now is to develop even more depth.
And you've got 15 what you call chairs that are very specific in terms of research and end up being clinical. Back then we had no chairs, is that true?
Children's Medical Research Institute, when I arrived, had 4 endowed chairs. And now they have completed fundraising, and we have recruited and filled 15, and there are approximately that many in addition in the pipeline.
So is it safe to say back then, again, post-oil and state organization, that we were doing you were doing acute care and some research, but not in a competitive way with, say, Arkansas, Denver, St. Jude's obviously is huge, but we were not at that level back then.
I'd agree with that. I would say
good care, but not on the research.
Yeah. We took care of. We felt that our most important obligation was to care for the children of the state, but it was much more difficult to get to the in-depth education and certainly get to the in-depth research because the resources just weren't there.
Yeah. Okay. So just so I can educate the viewers. Dr. Stull is the chair of the pediatric department under the College of Medicine, University of Oklahoma, as well as you're the scientific advisor for what's called Children's Medical Research Institute. That's the group that raises money to bring in doctors that we're going to talk to, as well as research. What other mission does the Institute have? And that's a nonprofit board.
Yes, the Children's Medical Research Institute, what we call CMRI, is a 501c3 nonprofit organization, and their mission is focused on research and education.
Okay.
And what works so well for them is that by focusing on research and education, we've been able to attract outstanding physician scientists who are not only doing research and education, but also care for our children.
Okay, so I'm a established doctor at Stanford Medical University or Hospital, whatever, or UCLA, and you have an endowed chair. Maybe you can speak to this, Bill, but what do you tell me? How do you sell me on coming to the University of Oklahoma College of Medicine and everything that comes with that? What brought you here, Bill, and where did you come from?
I most recently was at St. Jude Children's Research Hospital in Memphis. I was there for 14 years before Terry recruited me here. At the time that I left, I was a vice chairman in the Department of Oncology there. I came here in part because I saw great opportunities for this program to be more involved with our national research enterprise. I came here in part because I thought Terry would be a great person to work for, and in large part because of the tremendous community support, predominantly through Children's Medical Research Institute, to allow the program to grow and prosper and get stronger.
So the Institute helps recruit because you're seeing a commitment on raising money, which is critical for research, and that's what I understand. There's a research element, there's clinical, and then there's teaching. Is that
Absolutely.
pretty typical at a university or hospital or children's hospital?
It's really very typical. Most people in clinical departments are at minimum involved with patient education, patient care and resident and medical student education, but the kinds of faculty that are really leading the way in my specialty are those that are involved with research, either at the bench or clinical investigation, which is where my strengths lie.
In the CMRI, without that, you're not going to be able to attract the research because you leverage the money you get locally to national grants, and has that been, have you made your goals there in terms of getting
our program has several $100,000 of research that supports our hemophilia programs, our sickle cell programs. They're both nationally competitive. It helps support my program that is doing very nationally competitive things with childhood cancer. I presently chair one of the major disease committees for our national cooperative group that allows me to have substantial influence over the direction of the research for that aspect of childhood cancer in all of North America.
So talk about that a little bit, your area of expertise and what you're working on, some exciting things, what Oklahoma maybe is adding to the national development of cure and solution treatment.
My major interest is in childhood soft tissue sarcomas. They're not very common. The most common of them, rhabdomyosarcoma, afflicts about 350 new children in the U.S. My job is to oversee our research direction, the clinical trials that we do, the translational research, identifying which new agents we're going to bring into clinical trials, all aimed at curing more kids and lessening the burden of therapy for those children where the cure is already pretty good. And we have several ongoing clinical trials through our national cooperative group, the Children's Oncology Group, aimed at doing exactly that.
Let me ask you, this is a kind of a very layman question. Cancer is, whether it's pediatric or whatever, it's been around forever. But for someone who reads and hears a lot about it, is it increasing the number of cases per capita, or are we just more aware of it? And in the past, it just wasn't treated, or is there environmental? Is that a tough question?
I think it's probably aspects of all those things. Clearly,